In a recent development, New York City Comptroller Brad Lander has made a significant request to federal health officials regarding actions taken by former Governor Andrew Cuomo during the COVID-19 pandemic. Specifically, Lander is urging the Centers for Disease Control and Prevention and the Centers for Medicare and Medicaid Services to investigate whether Cuomo's controversial directive from March 25, 2020 violated any federal health guidelines. This directive required nursing homes to accept patients recovering from COVID-19, a move that has been widely criticized for allegedly contributing to a tragic number of deaths among the elderly. The importance of Lander's request cannot be overstated. He argues that understanding the legality and ethics of Cuomo's decisions is crucial for public health accountability. The city comptroller is not alone in his concerns. Many analysts and health experts have questioned the validity of Cuomo's claim that the directive was in line with federal guidance. In his letter addressed to the heads of the CDC and CMS, Lander pointed out that Congress's coronavirus subcommittee had previously concluded that this directive was inconsistent with the guidelines offered at the time. Such findings raise serious questions about the decision-making processes during one of the most challenging public health crises in recent history. Additionally, the Comptroller's inquiry underscores a critical issue surrounding governance and transparency in healthcare decisions. Cuomo has repeatedly stated that his March directive complied with federal health regulations. However, Lander has challenged this assertion. By asking for clarification, the Comptroller hopes to shed light on the federal guidelines that were in place when the directive was issued. Lander is seeking to clarify whether Cuomo consulted with anyone at the CDC or CMS before enacting the order, a point that could significantly affect the narrative surrounding the governor's decision-making during the pandemic. As the situation unfolds, the implications of Lander's request could have far-reaching effects on public health policy and the accountability of elected officials during emergencies. With Cuomo reportedly considering a political comeback, the scrutiny over his actions may intensify, affecting not only his future prospects but also the political landscape in New York. It presents a crucial opportunity for public dialogue on how government officials respond to crises and the standards they are held to when making decisions that impact human lives. In conclusion, Brad Lander's appeal for an investigation into Cuomo's March 25 directive reflects ongoing concerns about the management of COVID-19 in nursing homes. It serves as a reminder of the need for transparency and accountability in public health policies, especially during unprecedented times. Keeping a close eye on how federal officials respond will be essential in understanding the full impact of these decisions on public health and governance.